This is an interview with my mother, Gina, who is a cancer survivor, a two-time cancer survivor. But today we're going to talk about primarily your experiences with surviving cervical cancer. So, go ahead and tell me what that was like for you.
Okay, well, I first found out that I had cancer I won't say accidentally, because I did have routine PAPs, but I was working for a new doctor. I just graduated from nursing school, and I was in a job where I was able to take, over a week off at a time. And so I went to Hawaii, and while in Hawaii, I got a call from my doctor, my employer, which was very odd, for him to call me like that. So he told me that I had an abnormal PAP and that I should try to get back to the mainland as soon as possible to have further studies done, which I did, but I was very surprised. It just didn't seem real. Anyway, I continued to have other studies, a series of colposcopies, which is a microscopic examination. Basically the doctor is like doing a pelvic, but with a microscope instead of just a speculum. And they found that indeed I had a lot of abnormal cells. So they decided that what would be better than repeating the colposcopies would be to do what's called a colconization, where they cut out a cone-shaped segment of the cervix, and they hope to get all of the cancer cells that way without having to do a full hysterectomy. So I had that done, and I was just like a day post-op when my partner's father died, and he returned to where he had grown up, to his father's funeral, and came back absolutely devastated and in need of contact and comfort. So we wound up making love before I was really cleared to do so, and I got pregnant instantly. And about a month into the pregnancy, maybe a little bit more, I went ice skating. I didn't think much of it. I was pretty active in those days, and came home and hemorrhaged. I mean, really severely hemorrhaged. And so I figured that I had lost the pregnancy. And that was devastating to me. I already had a little 4-year-old daughter who I adored, and I was just very sad. Actually,
At that,
you were about 6 or 7 at that point.
I was
7, sorry.
almost 7 at that point. 4 when it started.
Yeah, 4 when it started, and about 7 when I had the second pregnancy.
Mm-hmm.
And so I went back to Hawaii because that's where my heart and my comfort were. And I brought my daughter with me, of course, and stayed with a friend. But I remember that I couldn't even climb a few steps on a flight of stairs where I was staying. I was just absolutely exhausted, and I couldn't keep any food down. And I thought, what's the matter with me? Am I so depressed about this that I'm making myself sick? But anyway, so I went to a doctor, and he said, no, you are pregnant. You didn't lose the pregnancy when you hemorrhaged, which made me very, very happy. And so all I needed was some iron supplements and prenatal vitamins, and I was on my way to having my baby.
And you thought that the cold conization had taken care of the cancer. So as far as you know, you were just going to have this baby as a single mom again, and that was going to be it, because your partner was back in California, and you didn't know that you had cancer still at this point, right?
But then further into the pregnancy,
how much further?
At 4 and 5 months, when I was in Hawaii, we had moved to the Big Island, and I had a doctor. Actually, I worked for that doctor also, and he said because of the risk of possibly having a herpes outbreak, that I should be followed very closely, and because of my history of dysplastic cells, I should be followed very closely. So I went every month or so to Oahu a neighboring island to get more specialized care.
That was to the specialized women and children's hospital, right?
Right, exactly, Kapiolani. And at 5 months pregnant, I was told that evidently the cancer seemed to be spreading and becoming not just dysplastic cells anymore, but
Right. And why was that? What did they tell you the
well,
reason?
I was going to say that because the hormones of pregnancy were speeding it up
Right.
and making it worse. And they couldn't tell what was going on without dilating my cervix. And my baby was only 5 months. I was only, 20 weeks pregnant. And there was
not viable. Yeah.
At that point, that a baby could have survived, and them dilating me would have brought on labor. So,
and when you went for these routine visits, you didn't go with anybody, right?
No, I
you
had to go
would go by
alone.
yourself.
Yeah.
So you had this news. You found out you're still, not only still had cancer, but that it was progressing rapidly.
And that it could spread to my lymph nodes and
Right.
alter my body and
Right.
wind up killing me. So I had the choice. I mean, it was literally a choice between killing my baby or killing me that they gave me. And I sat alone and wept in the airport by myself. Ooh. Okay. That was hard. Anyway, I got home and I thought about it for a while and talked to my friends and my partner. I think I even talked to my daughter, who was then about 7, and we all decided that it was going to be okay, that we were going to have faith that it was going to be okay. And so I went ahead and opted to carry the pregnancy to term, which I did. And then in labor, because of all the scarring on my cervix, I had 12 hours of really hard contractions against scarred tissue that couldn't dilate. So it was going nowhere. It was just pounding and pounding, and the cord was wrapped around her neck. And I was an OB nurse that worked in that unit too, so I understood what was going on with the monitors. So I didn't have the blessing of ignorance. I knew how serious and critical things were.
That must have been terrifying.
It was terrifying. And it was also incredibly painful. I really felt like I was being ripped apart because my body was trying to rip open to let this baby out. And I told them at 12 hours, if you don't do a C-section, I'm going to get my bandage scissors and do it myself. Of course.
And then what happened?
And so they did a C-section.
Oh, no, but before they did the C-section, when your charge nurse...
Oh, yeah. So my charge nurse, my boss, comes into the room to check me. And here I am, a labor and delivery nurse. Oh, God. Anyway, she comes to check me during a contraction, and it was so painful, and I was just so out of it that I kicked her all the way across the room, like against the door. She hit the door. That was good. Luckily, I didn't get fired. But anyway, because women can get a little crazy at that point.
I'm sure a labor and delivery charge nurse understands.
She did understand. She was cool about it, but I was devastated. So I felt like a real failure as a nurse and as a mother. I felt like I'm not being successful at delivering this baby, so I'm a failure on 2 very profound levels. Motherhood was so deeply important to me. I loved the daughter that I had. I loved the daughter. I didn't know she was a daughter then, but I loved the baby in my belly. And I loved being a nurse, and I felt like a complete failure at everything at that point.
Did you feel like you were supposed to be able to deliver her vaginally because you were a labor and delivery nurse? Like you should have had some expert knowledge?
Yeah, right. My body.
Never mind that you're literally scarred
I've
shut.
helped on, hundreds of deliveries, so why can't I do it right? Yeah, so that wasn't so great. But anyway, so they did do the C-section. And thank God I didn't see how blue she was. But I guess the cord was wrapped around her neck 3 times tightly, and they had to resuscitate her, which I didn't know until years later when I saw the operative notes. But anyway, so life went on. And immediately following the C-section, they gave me less than a month before they did a hysterectomy.
Was it a total or a partial hysterectomy?
They did. Well, it's called, I guess it would be called a partial hysterectomy, meaning that they completely took out the cervix and uterus but they left the ovaries and the fallopian tubes. So I still had hormones. So anyway, so we both survived, and I'm so
How did that affect you? That
Oh, okay.
hysterectomy and
All right.
that experience?
Afterwards, when I was recovering, I remember feeling, aside from feeling really dirty with the cancer before I had the cancer taken out, I felt, am I really a woman? Even though I have 2 children and I'm breastfeeding one of them, I'm really not a complete woman anymore. But I'm very grateful that I grew up in a culture where my identity was reinforced on many other ways: my intelligence, my art, my how loving or kind I could be. That those were the values that were stressed when I was growing up, rather than that my whole identity was to be a mother and nothing else. So I was able to work through that fairly quickly. And
Did this have any lasting effects on your life, this cancer or this experience?
absolutely. Oh, one of the things I didn't mention was that when I had cancer before the pregnancy, even, I worked with Dr. Symington's group. He was a doctor who pioneered the use of meditation and visualization in healing. Cancer was the first thing they worked with. They've since worked with other disease processes and using meditation and visualization for those. But I had seen his work when I was a nursing student before I was pregnant. And then 3 years later, I found suddenly I'm a patient using his technique, and I had a volunteer that I could call 24 hours a day if I had problems. And I remember, they say you can visualize, cartoons of a cancer cell and a normal cell, and healing the cancer or whatever. But being a nurse, I visualized a normal cell and then a cancer cell, and the cancer engulfing the normal cells and reproducing and spreading, and then my white blood cell system, my phagocytosis, coming in like Pac-Man eating up the cancer cells. But one night,
So literal.
I had a problem with that, and I couldn't get my visualization to work where the white cells were killing the cancer cells, and the cancer cells turned around and started killing the white cells. And I was in absolute panic, and I am so grateful to those volunteers because I was able to call and talk to her, and she assured me that it's just a process, and to try again, to take a breath, to do the relaxation and try the meditations again, even while she stayed on the phone, until I felt that I was okay, and that the visualization was a healing one and not a destructive one.
Did you feel as a nurse that you had a more vested trust maybe in the biomedical system, that that they were going to be able to heal you during this process, since you were a nurse already when you were diagnosed with cancer? Or did you have more of a peek behind the mirror, behind the curtain, so to speak, and maybe it was harder to trust because of it?
Well, I think having been to Symington's workshop as a nurse before I had a problem myself was an eye-opener and a heart-opener, that it enabled me to see that, and here he is, a doctor, a well-respected doctor and clinical researcher, who was coming up with this. Bernie Stiegel followed in that pursuit and became very famous for working with visualizations for cancer and other things. But so I trusted him. He was a doctor. It was a scientific presentation when I saw it. And also, I'm 72 years old, so at those times in the 60s and 70s, I had had enough experiences with spirituality that I was able to go beyond my medical training and realize that there is a world other than just the cut and dry black and white world of medicine, that healing is a very multifaceted thing. And I knew as a nurse, one of my roles was to make people feel safe, that was often more important than the IV bag of medicine that I was hanging, was to come in and be a human being with compassion.
Did you trust the medicine, though, is what I'm asking? As a nurse, did you trust the medicine also? Like I'm, in addition to the
except that I did
complementary
try some
medicine.
but here I had it backfire on me a couple of times already.
Right.
The colposcopies weren't enough, then the colconization wasn't enough, and it was like one thing after another. So in the back of my mind, I still thought, this could still come back. This could pop up at any time. It could have, a few cells could have gotten into my abdomen and could attack my bladder, could attack my intestines,
Did you think that at any point, did you actually think I'm gonna die, or I could die, this could kill me? I mean, I know you had to know that as a nurse, but or did you just think if I do the treatment, everything's gonna be fine?
It wasn't just the treatment. I felt that if I do the treatment and I do the work,
right,
of eating healthy, trying to live as healthily as I could, and doing the meditation, trying to bring my life back into balance. Later in my life, I studied a lot of Native American medicine, and then I got my master's in Oriental medicine. So I think I always had a tendency to feel that there was more, that they were both important, that there wasn't just one way, that there were many ways to heal, and that if one is not working, it's really important to try other things. What are you trying?
Is there any last thing that you want to share on this experience?
Oh, you're going to wrap it up. Okay, I did get cancer again. I had a period of 18 months where I'd been given the wrong medication for somebody over 65, and I was stopping breathing and losing consciousness, and all kinds of terrible things were happening. And I was in the hospital 30 times in 18 months and intubated 28 times, and in ICU every time I was intubated. And because I had no more veins, one of the times I got septic pneumonia, and they had to give me life-saving antibiotics, but I had no veins left because they had been giving me IVs, constantly. So they did a chest
port
catheter port, yeah, and that turned into squamous cell carcinoma. I thought it was just I thought I had a shingles or something, and I went to the doctor, and he said, no, it does not look good, and came back and then biopsied and came back and said, no, it's squamous cell, and you need to be very careful because that can spread like melanoma. So I've had this cancer dance twice, survived a bunch of things twice, started out as a 3-pound baby, and I feel I'm getting healthier all the time.
And you are still standing after all this time?
Yep.
All right. Thank you.
Thank you.